So, hi everyone, welcome to this Take 20, the brain-mouth connection, mental health and oral health. Today's Take 20 will be led by Dr. Judith Haber and Jessamine Cipollina. The purpose of today's Take 20 is to examine the brain-mouth connection, identifying links between mental health and oral health. And before we get started, I will just address a few housekeeping items. This presentation is being recorded and will be later posted on Open's online community at communities.openoralhealth.org. I will also add the link to the chat in a few minutes. If you aren't familiar with the community, you should go to the link, request a login, and gain access to Open's resources, policy alerts, and network-wide updates. If you have any questions, please pop them into the chat and we will have Q&A at the end. You are all currently muted, but we ask that once the team is finished with their presentation, you can unmute yourself to ask a question, or again, by putting it into the chat. But now I will turn it over to Dr. Haber or Jessamine, either or. Also, we are asking that you please fill out a meeting survey after, which I will also put into the chat. 1 second, to evaluate the meeting and how helpful and useful the resources are that are coming from these Take 20s, which I will add to the chat right now. So please give a few more minutes to I guess get Dr. Haber on the line, and we really appreciate your patience with us. Thank you so much.
I don't have any audio.
Okay. Hello, everyone. Sorry for the delay. Dr. Haber is now here.
I'm here. I was trying.
So I'm going to share my screen. Wow, so many problems today. All right.
Hi, Valerie. Good. Okay. Are you doing from the beginning?
Yes. You see the slide?
I see it. Yes.
Okay, go for it.
Okay. Hi, everybody. Thanks so much for joining today. I see we have a great sized audience and delighted to have you for the brain-mouth connection, linking oral health and oral health, mental health and oral health. Anyway, this is an often overlooked connection. We've all gotten used to, or more used to, linking oral health with overall health, but this aspect of it, mental health and overall health, and some call it behavioral health, is all too often forgotten. So we hope that by the end of today, myself, the professor of nursing at NYU and executive director of the ONEP program at NYU College of Nursing, and Jessamine Cipollina, program manager for ONEP, will shed some more light on this, and we'll have some time for questions. So next slide, please. I think most of you know about ONEP, the aim of which is to integrate oral health into overall health in undergraduate and graduate nursing programs. And equally important is to establish best clinical practice related to oral health in clinical settings, including mental health / behavioral health settings. And this is a screenshot of our ONEP website, which has a wide variety of resources related to interprofessional collaboration, linking oral health with overall health, and you will find resources, as we'll talk about later, about linking oral health with mental health. Next slide, please. We believe that it does take a village, that the prevention and management of mental and oral health issues does call for the collaboration between dental and non-dental providers. We all have significant contributions to make in caring for patients with both mental health issues and oral health issues, as well as the other overall health issues that may come into play. In terms of, as you'll hear, screening, patient education, counseling, coaching, managing treatment in a collaborative way is all so important. Having such a large and diverse workforce only enhances communication across the professions. And certainly, as you'll see on the next slide, please, you will see that beyond dentists, nurses, nurse practitioners, physicians, there are so many other providers, types of providers, who are integral with promoting both mental health and oral health, as well as overall health. Social work, for example, comes into play in terms of the social determinants of health, which are so much a part of the whole person care for people with mental health problems, particularly those psychiatric disorders that are severe and persistent. But it affects nutrition, it affects public health, it affects pharmacy. This is a patient population that is notably affected by the medications they take in terms of the oral health side effects that can lead to such severe decay and other problems. Next slide, please. So keeping in mind the patient at the center of our concern, the patient, whether the patient's an individual, a family, or a community, or we're thinking about the behavioral mental health population as a whole, think about the oral health delivery framework. And whether you're being educated on the dental side, the nursing side, the medical side, the social work side, physician assistant side, or whether you are a clinician practicing from any of those perspectives as a team member providing whole person care, think about, especially from a mental health perspective, that oral health questions should be included in whatever history you're taking, whether it's an overall health history or a mental health history. You want to ask about the oral health of the patient as well. You want to look for obvious signs of oral health risk or active oral health disease, or on the dental side, you want to think about the overall health problems that your mental health psychiatric patient might be having. You want to decide on the most appropriate response or course of action, and then integrate mental health or oral health or both in your preventive, treatment, or referral interventions. And we'll talk a little more about appropriate referrals that need to be made bidirectionally. And always remember to document in your electronic health record whether it communicates across professions or not about either the mental health or the behavioral health or the oral health findings that you are identifying as a result of your ask, look, decide, and act. Next slide, please. And aligning with this oral health framework is to think about he, not, to think about transitioning whatever you think about the head, ears, eyes, nose, and throat to always include the O, the oral health components of the history and the physical, especially important if you are on the primary care or mental health side of patient care. Similarly, it's just as important for the dental team to think about mental health and overall health as they construct an assessment, diagnosis, and treatment plan for patients as well. Next slide, please. So now I'm going to pass the baton to Jessamine, who's going to provide a more clinical portrait of the oral systemic connection in relation to oral health and mental health. Jessamine, take it away.
Thank you so much. So obviously we're talking about mental health and oral health. We know that the mouthway, we call it the gateway to the rest of the body. And this includes the brain and the mind. And this month is Mental Health Awareness Month. So in recognition of this, we're raising awareness of this brain-mouth connection and talking about how good oral health is essential to improving mental health and protecting mental health and overall health. Oral health, as we know, is something that continues to be overlooked by a lot of health professionals as this key component of overall health. Despite research and evidence demonstrating the importance of oral care. And we see a lot of this research being brought up over the past couple of years, in particular about the relationship between mental health and oral health and mental health in the rest of the body. So today we're focusing on several health conditions. Looking at this image that will come back to us later on. These are some categories of mental illness that are common. I'm sure there are many more that aren't listed here, but all of these share a lot of similarities in how mental health and oral health are connected. Coming out of the COVID-19 pandemic, particularly early on in the pandemic, and looking at the future, the isolation and financial hardships of the pandemic affected mental health status across the US and globally. According to the World Health Organization, based on surveys and reports, the global prevalence of anxiety and depression overall increased about 25% as a result of the pandemic. And the issues that link poor mental health, talking about insecurities related to their own poor oral health and general reluctance to visit the dentist, these have all been exacerbated. And now we're in this post-pandemic world. The pandemic brought a heightened awareness of mental health and how it affects the rest of the body. Some other things to consider as a result of the pandemic, there were a lot of reports of increased substance abuse and suicidal ideation in a lot of communities and among a lot of individuals. Increased incidence of domestic violence, particularly in the isolation component, couples and families that had to isolate together. A lot of issues came up, and as a result of domestic violence and any domestic abuse that occurred within couples and families has had a great impact on mental health status. And just overall decreased access to mental health and dental care physically due to a lot of closure of offices of primary care and acute care offices across the US, as well as people who've lost their jobs, who've lost their insurance just being generally unable to access adequate mental and oral care as a result of that. So this is a really good infographic from the National Alliance on Mental Health. They have a lot of great infographics like this one. There's a lot of statistics on here about US adults, about mental health status, how many of them are experiencing mental illnesses, how many are struggling to get care as a result of the pandemic, particularly in early pandemic in 2020. But a couple of things to note here is looking at the bottom, many increasingly use alcohol or drugs to cope with stress or to self-medicate. And not just with any sort of diagnosed mental illness, just general stress has been a key factor in how people are coping with any stress or mental illness that they're experiencing, using alcohol and drugs. This can all impact oral health. And things to consider when looking at oral health of those mental health issues, as we'll see in the coming slides. So people who have any sort of mental illness or mental health problem, a lot have an increased risk of oral health neglect, which can stem from mental health and behavioral health factors. Some of these are dental anxiety, substance use, like we talked about. Increased substance use is typically associated with depression and anxiety. Thinking about trauma and experiences, any sort of trauma history is important to consider as it relates to dental anxiety, as well as the home or oral health care, having to interact with your mouth in such close quarters with someone else or even on your own, can be really difficult for people with certain mental health problems, and just overall inadequate self-care as a result of a lot of mental health disorders. Other main key points are the side effects of drugs, antidepressants, mood stabilizers, antipsychotics. All of these include a higher risk for oral infections, periodontal disease, dry mouth or xerostomia, bruxism as well. And overall, just mental illness has a range of dysfunctional symptoms and behaviors, a perfect storm of factors that predispose people who struggle with any level of mental illness to maintain their oral health, and leads them to increased risk of oral problems, which can then have serious systemic consequences. Inflammation and infection in the mouth can spread to the rest of the body. So looking back at our diagram, in the interest of time, I won't go through each of these, but thinking about all different ways that mental illness can impact our day-to-day life. General stress that people have experienced. Stress overall affects the immune system. It impacts sleep patterns, personal hygiene, and can contribute to things like bruxism, grinding teeth or clenching teeth, not just in sleep, but throughout the day, as well as orofacial pain. People report headaches, jaw pain, sinus pain, things like that. Again, looking at, bipolar disorder is a mood disorder. Bipolar disorder can cause overbrushing. People may overbrush or overfloss, and this can cause damage to the gums and to the tooth enamel, as well as lacerations in different parts of the mouth. Higher rates of xerostomia, gingival hyperplasia, and stomatitis as a result of these medications. Again, lack of sleep causing a weakened immune system. Lack of sleep can also cause us to make poor nutritional choices. If you're tired, you're going to drink 7 cups of coffee without thinking about it. You might snack throughout the day, particularly on high sugar and high carb snacks. So that nutritional component is really important. Like we said, anxiety and trauma, they have similar issues with dental anxiety and dental phobias that cause avoidance of the dentist, and can also cause people to avoid interacting with their mouth as part of their own home oral hygiene. Moving on throughout the circle, obsessive compulsive disorders, they may brush and floss too often or too vigorously, which can damage the mouth. Depression and self-neglect, often resulting in poor oral hygiene, and again, higher abuse of substances that can cause decay. Substance abuse alone with illicit substances like cocaine, amphetamines, opioids. Meth mouth is a really big issue within the US right now, thinking about how meth and other amphetamines can cause oral health problems, and recognizing those signs as a dental provider or as a non-dental provider are really important. So I'm sure there's many more disorders that I'm sure we haven't addressed here, but these are all considerations when we're looking at the mouth, thinking about it as the gateway to the body, and what needs to be considered when we have somebody who in our offices who presents with a mental health problem, and thinking about those considerations. So like we talked about, we have a great interprofessional team that can make a difference, that can communicate and collaborate with one another to educate their patients, have those discussions with their patients about the importance of good oral health care in the interest of improving mental health and hopefully overall health. Mental health disorders are complex, multifaceted, require a lot of different aspects of care, which dictates this team-based approach. Again, thinking about the social determinants of health, people who may have lost their jobs during the pandemic, who may not have access to regular mental and dental care. Screening patients, including oral screenings for dental and oral hygiene in non-dental offices, and thinking about in the dental chair, any mental health issues and mental health screening that might be incorporated into this. And the usual educating patients on the importance of good oral health care, helping them to manage and prevent inflammation and infection in the mouth, and documenting any of these findings and providing referrals as appropriate across the whole health professional team. So mental health, it provides this really great exemplar for bringing all health professions together to connect on, encouraging brushing, flossing, nutritions, avoiding substances or cessating from abusing substances. So with that, I'll go turn this back to Dr. Haber to tell us about some more resources and options for learning more about mental health and oral health care.
Thanks, Jessamine. I really want to point out this and highlight this amazing resource that recently came out from the National Council for Mental Wellbeing. And this was funded by SAMHSA, which is one of our federal agencies. And I particularly want to point out to you, if you download it, page 7 has a wonderful exhibit, they call it, about the relationship between oral health, mental health, and substance use challenges that really highlights in a very targeted way, like Jessamine did, about the effect of different psychiatric, mental health, behavioral health problems on oral health. And then the other figure 2 on page 11 that I want to point out to you has a wonderful table about the coordination and integration for oral and behavioral health providers. This relates to the slide that Jessamine presented, different from it, about different models and ways in which health professionals can collaborate, both oral health providers and mental health and substance use treatment providers. I thought they were excellent, down to earth, and very to the point. And the other thing I want to make sure you read when you download this report is that they have, and you rarely see this, they have recommendations for codes that you can use as both a mental health provider or a dental provider related to getting reimbursed, being able to get reimbursed for codable services that you provide on either the mental health side or the oral health side about both of these health issues. I really highly recommend it to all of you. Very readable. Next slide, Jessamine. Tomorrow, we're having a tweet chat, mental health and oral health tweet chat at 2:30 p.m. This tells you exactly how to sign on to join us for that. It's a half hour, and these tweet chats are really fun. Jessamine is a genius at planning them and hosting them. So we look forward to any and all of you joining us tomorrow, either as a co-host or as a participant. Just email Jessamine and she will sign you on as a co-host. Next slide, please. And we wanted to point out a couple of ONEP resources. So this is for those of you who are non-dental providers in the audience. This is our ONEP undergraduate interprofessional oral health faculty toolkit. And there is a psychiatric nursing course here that is key to the AACN essentials, to the IPEC competencies, and it will provide you with a vast array of readings, classroom and clinical activities, and collaborative interprofessional activities. This can be used in either a clinical setting or a classroom setting. Next slide, Jessamine. And this is online open access on our ONEP website, as is this graduate interprofessional oral health faculty toolkit. And as you can see, we have a toolkit for any students or faculty who are enrolled in psychiatric nurse practitioner programs. And it's very interprofessional, again, geared to the essentials, the non-competencies, and the IPEC competencies. Next slide, please. And of course, Smiles for Life. There's a very nice piece on mental health, behavioral health disorders, and oral health in the adult module. I believe it's module 3, and in the first module, the relationship of oral and systemic health. And remember, free CEs for nurses, physicians, dentists, social workers, physician assistants, etc., for completion of these modules. Next slide, please. And keep in mind, like with diabetes, cardiovascular disease, cancer, oral health, and mental health requires a partnership. And patients, families, and communities do best when we collaborate to provide coordinated, whole person, person-centered care. So thank you. And now I think we have a little time for a couple of questions. Oh, there are in the chat, Jessamine.
Yes, so the slides will be available after the presentation. Very sorry about the the presentation view and all the other technical difficulties again. I'm also putting in the chat a link to the oral health, mental health, and substance use treatment framework that we shared. I agree with Teresa. We could go on and on and on for up to like an hour on this topic.
Yeah, the one thing I just want to mention, and because I am a psychiatric nurse practitioner, believe it or not, what am I doing in oral health? Well, it's the same idea, integrating behavioral health with overall health, integrating oral health and mental health. It all works. But what I want to just mention is that for the patients, the populations that have serious and persistent psychiatric disorders like schizophrenia, remember, patients who are on antipsychotics, which could be patients with mood disorders as well, are very vulnerable to the metabolic syndrome, which would increase their risk for diabetes, cardiovascular disease, hypertension, and we already know about the increased risk for periodontal disease for patients with any of those chronic conditions. And similarly, we know that effective management of their periodontal disease improves their overall diabetic, cardiovascular, and hypertensive status as well. So whether it's mild stress, moderate stress, or whether it's a chronic major psychiatric disorder, this applies across the continuum. And I was so surprised to learn more, think more about the relationship of trauma, people who've had trauma in their lives, particularly sexual trauma, and their increase and what a trigger going to the dentist can be for that population. And so I hope that we all have a heightened awareness about the importance of the links between oral health and mental health conditions, issues, and all of which, as Jessamine said, have been so exacerbated and highlighted for us as a result of the COVID-19 pandemic. And I think we have to stop now. So thank you. And if any of you have questions that are unanswered, either join us tomorrow on the tweet chat, or just email us. Our emails are posted, or Jessamine will post them. So thanks a lot, and take care and have a great rest of your day.
Thanks so much, Dr. Haber. Thank you, everyone.
Thank you.